It's been a while since I last posted. I have to get back to documenting my story as I'm slowly beginning to forget the details and the feelings. I don't want that to happen. So let me recap the timeline. I got diagnosed with heart failure, end-stage heart failure in April of 2022 with 1 week of hospitalization in Bellevue, Washington. And when the doctors agreed to discharge me, I flew back home to Chicago and we found a heart failure clinic close to our place. It's about a mile away. So from April to September, I was seen by the amazing doctors, cardiologists, and nurses of Illinois Masonic. We talked about having to undergo a heart failure treatment plan, which included plenty of heart medications to help lower blood pressure, improve blood flow, and strengthen heart muscle. And there are also some water pills to reduce fluid retention. I was almost in the clinic at least once a week, as I remember. There were a few visits where I had to take IV drips of diuretics, which works faster than pills whenever I have accumulated so much liquid in my body in a short period. Then part of the treatment plan is lifestyle change. These can help prevent and manage heart failure by reducing risk factors and improving overall health. Some examples are eating low sodium, low salt, and low fat diet, limiting alcohol, exercising regularly, which I do anyway before, and managing stress, which I don't do before. I decided actually to take a full medical leave to eliminate the work stress factor. I'm just grateful that I work in a company with colleagues in the medical field, so they completely understand my situation and are very supportive in many ways. So every day, I walk or do a light jog by Lake Michigan, just across our place. And as recommended by my cardiologist, I enrolled in a cardiac rehab program where I spend an hour or so in the cardiac clinic for cardiovascular health education, counseling, and do some exercises like treadmill, stationary bike, and stepper, while hooked on heart monitors. And then many tests happened after that, including a pulmonary stress test that measures how well my lungs and heart work during physical activity. It can also tell how severe my heart failure is. It involved breathing into a mouthpiece connected to a machine while exercising on a treadmill. The machine records the amount of oxygen and carbon dioxide in your breath and your heart rate, blood pressure, and oxygen saturation. I remember acing it. I reached the level 6 intensity actually, I think, when I was almost jogging. I had a glimmer of hope that my body would overcome this heart failure after seeing the result. Nevertheless, my doctor suggested that I start the evaluation for the advanced therapies in case the worst scenario happens. The evaluation is a comprehensive process that determines whether I am suitable candidate for advanced therapies such as LVAD or what I have right now, the left ventricular assist device, which is a heart pump, and heart transplants. I agreed to get started with the workup. At the back of my head, I thought I would never reach that point where I needed them. The evaluation includes a series of consults, tests, procedures, and plenty of blood work. It aims to assess the extent and the cause of my heart failure, and then the health of my other organs, and my physical, mental, and social well-being. First diagnostic test was ultrasound, which is an imaging test that uses sound waves to examine your neck, liver, gallbladder, pancreas, and other organs for any problems that could affect your heart transplant outcome. Next was an echocardiogram. It's an ultrasound test that evaluates the structure and function of your heart valves and heart muscles. It also measures your ejection fraction, which was 15% for me. And this is the percentage of blood that your heart pumps out with each beat. There are many blood and tissue tests. These are checks for blood type, blood count, kidney and liver function, immune system status, and exposure to certain viruses. I remember there was a dental examination as well, which is to check for any infection or issues in your teeth and gums that could cause complications after a transplant. Also, I have undergone a pulmonary function test, which is a non-invasive test that shows how well the lungs are working. So the test measures lung volume capacity, rate of flow, and gas exchange. The ventilation perfusion scan, which is a nuclear imaging test that detects any blood clots or abnormalities in your lungs, which is also called chest CTA or computed tomography angiography, was performed on me as well. Then part of the evaluation was to meet with transplant team members, such as the cardiologists, surgeons, nurses, social workers, psychologists, dietitians, and pharmacists. They all reviewed my medical history, medication, lifestyle, and support system. And also there was a lot of education on heart transplant and LVAD surgery, and then post-transplant and post-surgery care, and potential complications and side effects. And then lastly, there was cardiac catheterization, a minimally invasive procedure that measures the pressure and blood flow in your heart chambers and arteries. It also helped to detect blockages and defects in my heart, where they put a catheter in my neck artery that goes straight to my heart and do some measurements like pulmonary pressure. So the next 5 months, from April to September, I have been doing everything stated in my treatment plan, including all the lifestyle changes. I could even travel with my family to a few places, and I can still do everyday normal chores. However, I cannot deny the fact that I still feel some unusual symptoms, like shortness of breath, inability to walk upstairs without getting too exhausted, and water retention whenever I eat something salty. I was trying to be optimistic that I was getting better, but in reality, my heart was just struggling to keep up with my body, with my mind, and just flailing overall. So that right heart catheterization in September uncovered that my pulmonary pressures were 3 times elevated than normal. So that supposed outpatient appointment became day 1 of a 45-day hospitalization to begin the advanced treatments that I never expected to happen.